Good morning, and thank you for being with us. I'm Eric Parker. In the heart of the COVID crisis, Dr. Ranney was one of the go-to national leaders in medicine to whom people turn for information. Last month, she made a big career move, joining Yale as the Dean of the School of Public Health. Dr. Ranney joins us this morning. Thank you so much for being with us. How's the first few weeks on the job going?
It has been delightful, certainly drinking from a fire hose as I get to know New Haven and Connecticut and the Yale community, but I am so happy to be here.
Well, let's talk a little bit about how you got here. You have an undergraduate degree from Harvard. You have an MD from Columbia. You were the previous deputy dean at Brown. Now you're at Yale. By my count, you've done half the Ivy League, which is awfully impressive. But also, every article I could find to read about you, I saw two words I kept seeing: innovative and transformative. So what is it about you and your style that kept having people use those words?
So in addition to being a public health researcher and leader, I am also an emergency physician by training. And one of the things that we learn in emergency medicine is how to mobilize scarce resources to do the very best that we can for the patient in front of us and for the larger community around them. I have spent my entire life being trained and delivering on finding a problem and fixing it, and helping to empower the team around me to do the same. It's part of what attracted me here to the Yale School of Public Health is the opportunity to do just that for the School of Public Health, the larger Yale community, and of course for New Haven and Connecticut in collaboration. The same way that I would run a shift in the emergency department, I hope to work with the community here to help us achieve better health for local residents as well as for the nation and the globe.
Well, that's exactly what I wanted to ask you about next, is that, people might be watching this and say, Eric, why do we care? We're not going to that school. We're not professors at that school. What do we care who the new dean is? But your role in that role has a larger community focus. Tell people about that, because people who may have no connection to that school may be impacted by your work, right?
I sure hope that they will be. I mean, public health is really ultimately about the public. If I go back 3 or 4 years, when I told people I was a public health researcher, most people didn't know what I meant. Now, when I say public health, people think about COVID. They think about vaccines. Maybe they think about water quality and air quality. But public health is so much more than that. It's about helping to set up the infrastructure and the society that helps all of us to achieve physical, social, and emotional well-being. That's my goal here at the school, is to work, again, with local communities, both in New Haven and across Connecticut, as well as folks across the nation and the globe, to help set up the science and then turn it into practice in ways that make us healthier. I'll give you one example. I have wonderful researchers here at the School of Public Health at Yale that are doing really neat work around measuring a community's vulnerability to heat. We're coming out of the hottest July ever on record, and folks are forecasting that future summers are only going to be hotter. Wouldn't it be nice to have data to help us identify how at risk our neighborhood is, and then know what to do to help mitigate that heat so that we and our parents and our kids and our pets can stay healthy and stay safe? Those are the types of projects that I'm excited to take on in collaboration with the local community.
Well, and you think about something like that, Dr. Ranney, people may say, well, I didn't have COVID. I haven't, the water quality, that's not, everybody's been hot. And that's something that can, like you said, expand that reach and maybe some of the solutions from that. I want to ask you about, like you said, 3 or 4 years ago, people might not have been thinking public health the way they do now. I remember asking epidemiologists who came on the show during COVID, and I said, this is it. You've been training your whole life for this thing. Now that we're sort of on the other side of COVID, what did you learn as a public health researcher during that time that you can apply to other issues we may face in the future?
So I learned a few really important things. The first is that public health is not just about epidemiology or biostatistics or behavioral science. Really, the best public health research and practice is done as part of that larger community. Some of the greatest successes that I was involved with during COVID were partnerships with engineers and teachers and journalists and, of course, business owners. We all had a goal of getting people back to work and school safely. Those were great examples of public health at its best. Another thing that I learned, that I think all of us learned, was that importance of communication. We don't currently do a great job in schools of public health teaching our students about how to translate the work that we're doing and share it with the public, how to work with community groups to make sure that they have access to good, reliable information about the latest health challenges facing them and their community. And that's really a core skill set for us going forwards that I look forward to growing here at Yale. I'll say the third thing that I learned was how important our approach is in the way that we contextualize data within health. I'm sure that you, like back where I was in Rhode Island, were presenting COVID numbers daily, if not weekly, thinking about how we interpret that data, what it means for us, how we should act based off of that data. Those are core skills that we need, not just within our school, but across society. And I look forward to helping to grow that data literacy across New Haven and Connecticut over the years to come.
As I read about you, another thing that came up in some of your research was firearm injuries. And like you said, looking at data and looking at health consequences, some will say that framing this as a health crisis is merely an end around on the Second Amendment because people get so emboldened in their positions, whatever they are, about firearms. What's your role looking at firearms, and how could that be applied perhaps in a state like Connecticut that has already taken some big leaps on firearm legislation?
So I have been working on the issue of firearm injury as a health problem for almost as long as I've been a physician and a public health professional. The underlying idea behind labeling firearm injury a public health problem is that then we can use all the tools that we have at our disposal in public health, the same things that we use to decrease car crash deaths, to decrease COVID deaths, even to decrease cancer deaths, apply those tools to firearm injury. And when we label it as a health problem, it helps take it out of those policy debates and really center it in that core issue, which is no one across the United States, whether they're a gun owner or not a gun owner, wants to see themselves or their family members be a victim of gun violence. 84% of adult Americans say that they have changed something in their life out of fear of them or their family member being shot. That number is actually higher in Black and Hispanic communities. We have not just a gun violence epidemic on our hands, but also an epidemic of fear because of the rising number of gunshot wounds. And so that public health approach allows us to come together across partisan lines to put solutions in place that both respect the Second Amendment, but also acknowledge that we need policy and we need culture change outside of policy. Things like making sure that our firearms are stored safely, making sure that people who are depressed don't have access to a gun, making sure that kids have community mentorship and have access to a safe place to go play in a park. Those are core concepts to public health that when we apply them to firearm injury, make a big difference.
Well, certainly a ton of interesting topics, and I hope our viewers have gotten a lot out. And I hope you'll join us again in the future as you have more of these programs moving forward and more research. I was going to ask you who you're going to root for in the game, but I see you've already pledged to a publication at Yale that you will root for your current employer in the game when that happens. That's a big deal in the Harvard-Yale circles. We appreciate you being with us, Dr. Megan Ranney. Congratulations, and thanks for being here on the show.
Thank you.